Setting your fees as an anaesthetist in private practice? Here's what you need to know. Hi, I'm Ben, Managing Director of Zento. As an anaesthetist in Australia, setting your fees can be confusing and might even make you hesitant about starting your private practice. There's a lot to consider. Navigating the MBS, understanding the ASA RVG, and deciding whether or not to enter into agreements with private health insurers. It can all feel a bit overwhelming. Sometimes the easiest option is just to accept the rates set by the health funds, even though it can be frustrating, especially when you're getting paid different amounts for the same work. But it's a step you might feel you have to take to get things rolling and ensure your patients are covered. The reality is, without a clear understanding of how to set your fees, you run the risk of undervaluing your services or hitting your patients with unexpected costs. This uncertainty can lead to financial stress and awkward conversations that nobody really wants to have. But here's the thing, once you get your head around how the system works, you can set your fees with confidence. Let's walk through it together. First up, let's talk about the MBS. The MBS, or Medicare Benefits Schedule, is basically the government's guidebook for how much they reckon your services should cost. For inpatient procedures, Medicare typically covers 75% of the MBS rate. So if the unit rate is $20.95, Medicare chips in $15.75 per unit, and private insurers cover the rest, just $5.20 per unit. This is pretty much the baseline. Knowing these numbers helps you avoid setting your fees too low or getting caught out by underpayments. Then there's the private health funds. Each one has its own set of rules and fee schedules, which can be pretty different from the MBS. They're only on the hook for the MBS rate, but some will pay more if you sign up with their gap schemes. For example, while the MBS gives you $20.95 per unit, HCF might offer $34.55 per unit under a known gap arrangement. It's important to know where these differences lie so you can make sure your fees aren't just fair but also competitive. Now, let's get into the gap. This word gets thrown around a lot and it can mean a few different things depending on who you're talking to. The first gap is the difference between the MBS rate and what the private insurer is willing to pay. So if the MBS rate is $20.95 and the insurer pays $34.55, the difference, $13.60, is what they call the gap. But then there's the other gap, which is what your patients see as the out-of-pocket cost. Say you set your fee at $50 per unit and the insurer's only covering $34.55. That leaves the patient to cover $15.45 per unit. Some funds have a known gap scheme where this out-of-pocket cost is agreed up front, but if you go over a certain amount, the insurer may revert to just covering the MBS rate, leaving the patient to pick up more of the tab. It's really important to communicate this stuff clearly to your patients so they know what to expect. Finally, let's talk about the ASA RVG. The Australian Society of Anaesthetists, the ASA, publishes the Relative Value Guide, the RVG, to help anaesthetists figure out what's fair to charge for different procedures. The ASA rates are often higher than both the MBS and the private health funds, for good reason. Their guide reflects what your professional body considers your expertise is truly worth. For example, while the MBS might offer $20.95 per unit, the ASA suggests $100 per unit. Using the ASA RVG as a benchmark means you're not underselling yourself and gives you a perspective when considering whether to enter into an agreement with an insurer. Note, you need to be a member of the ASA to access the RVG, along with their member resources and benefits. By getting a handle on these areas, the MBS, private health insurer arrangements, the meanings of the gap, and the ASA RVG, you can take the guesswork out of setting your fees. And once you know how the system works, you can feel confident that your fees are fair and that you're earning what you deserve for the work you do. For more videos on topics about anaesthetic billing and private practice admin, don't forget to follow our channel.